This meeting is being recorded.
We just started recording. Hello, everyone. My name is Sohaila Bana with West Contra Costa Fire Safe Council. I'm very glad that Tony Semenza from CAER is with us tonight, who has had a very important role in establishing community warning system. And he's going to tell us all about the history and his experience with it, and possibly the current status or future prospect of community warning system. Tony, please, the floor is yours.
Thank you. First off, I want to congratulate the West Contra Costa Fire Safe Council for all the work you guys are doing. It's amazing what you've done in the short period of time in getting the people prepared in the event of a wildland fire and working with them and the evacuation plan. So congratulations on all the good work you're doing.
Thank you.
I'm going to give you a history of the warning system. And you see the first slide, it talks about the community warning system project. We actually started as a result of this July 26th incident at General Chemical in Richmond, California. But that was just the topping to what was going on in the county since 1982. From 1982 to 1993, we were having the equivalent of a level 3 incident almost every year. Level 2, level 3 incidents, which would be siren sounding incidents. But the General Chemical incident was the topper because when we had that oleum release in Richmond, California on July 26th, it involved a large plume of oleum being released from a tank car that was overpressured, and a ruptured disc ruptured on the tank car and sent an oleum cloud from that part of Richmond all the way to Pinole. It went north and it went east, but it covered an area that went all the way to Pinole. And what happened during that incident? Thousands of people wound up going to the emergency rooms to seek treatment for this. The oleum release, it's a toxic release. It's sulfuric acid, so there's a burning problem. There's an inhalation problem. So it was really a very, very bad incident. And as a result of that, people in El Cerrito, San Pablo, and Pinole were also affected. And then Dr. Walker, who was the head of health services in the county, came to CAER, Community Awareness Emergency Response Group. And at that time, we were just a group of fire security folks that were meeting monthly to talk about how we can help each other and learning from lessons learned and near misses and talking about best practices. So it was just a loose-knit organization at the time. But Dr. Walker was aware of what we were doing because some of his people in health services were also part of that group that were meeting every month. So as a result of that, he asked CAER if we would go out and look at a warning system for Contra Costa County. And that was a challenge. We were able in 3 weeks' time to build a team of 15 voting members and 5 additional advisors. And it was interesting because when we did this, we had our eyes on the community and cities, and we only had 4 of the 15 members were industry folks, 8 of the members were community and city representatives, and 3 of the folks were agency representatives. And that was from areas from Antioch all the way to Richmond. And then we had 5 advisors, and their job was to just sit in those meetings with us, and if they had some input, certainly the team wanted to hear their input. What we were able to do in a short period of time, we started meeting actually in August, and from August until we made a presentation to the Board of Supervisors and the Hazardous Material Commission, we spent about 1,500 hours looking at meeting and looking at what systems were available throughout the United States. So as you see there, we had the 15-member team. And we started meeting within 3 weeks of the incident at General Chemical. We had a subcommittee of that team went out to Harris County, Texas, different parts of Louisiana where there were other industries that were already using some alerting and warning systems, and we were looking at what might be the best fit for Contra Costa County. So it was a challenge. But by December of 1993, we had developed a 52-page report with a number of recommendations that we believed would be the best fit for Contra Costa County. Now, it was interesting because when we went out and when we came back, we all agreed that 15 team member and the advisors all believed that we should have a system that was an all-risk system. Could be used for fires, could be used for earthquakes, could be used for industrial incidents, just everything, any incident of any magnitude that might strike the county. But when we made the presentation to the community warning, when we made the presentation back to the Hazardous Material Commission and the Board of Supervisors, they wanted the system originally only to be used for hazardous material incidents. And the reason for that, as I said in the beginning, we were having a number of incidents, industrial incidents, from 1982 until 2000, 2001, with just serious incident after serious incident involving hazardous materials from chemical plants, refineries. And so Dr. Walker and the Board of Supervisors only wanted to use the system initially to be used for hazardous material incidents. So when it was finally built and tested, we gave it to the county in 2001, and we gave it to them, and they moved it into Contra Costa Health Services. You can see from that slide we talked about the turning it over or presenting it to the Board of Supervisors and the Hazardous Material Commission. When we did that in the hazardous pardon? When we presented it to the Hazardous Material Commission and the Board of Supervisors, like I said, they both endorsed it, and the Board of Supervisors came back and said, okay, now you've made all these recommendations. We want you now to take the recommendations and implement them. So what we did is we pared down the group from 15 to 7 representatives, and then we started to look at how were we going to implement the recommendations that we made. And one of the first things we needed to do was to hire a project manager. And the project manager we hired was actually from Richmond. Kathleen Imhoff was our only project manager. She was a young lady that lived in Richmond, and her background was she had done some work for the UC system on a number of different projects. We had interviewed a number of people who had applied. We posted for the job, and we had a number of people. We had a committee that interviews these folks, and we came up with Kathleen Imhoff, who happened to live in Richmond. So the system was built. You can go to the next slide. Oh, I'm sorry, you're on it. The system was built for, a little over $5 million. And when we started and we sat around and talked about what elements we wanted in this system, we wanted sirens. And the reason for all of this was when the General Chemical incident happened, there was a lot of confusion. There was a helicopter up over the scene, reporting back to a radio station that was giving information of evacuating. There was another news system talking about shelter in place. So there was a lot of confusing information that was going out. And the purpose of our system was, let's get a system that can provide accurate information quickly to the people in the affected area and provide them with the information they needed to be safe. So, it was because of conflicting information that was coming out across the news media. And so that was the main purpose of this. So it is, and it was at the time we built it, one of the largest public-private partnerships. It cost no tax dollars to build this system. We got all the money to build it from industry. And the way we did that is we had to put a number of committees together. So we had a committee that was looking at funding. We had a committee that was looking at education, because it's easy, you say we're building a system. If we're going to build a system and present it to the community, we better be doing education. Otherwise, the system's going to be useless. And one of the challenges we have today is continuing to educate people on the system. When we built the system, we wanted to have an all-risk system that you had to opt out, not opt in. So if it was built and you had to opt out, everybody would get it. And then if you had a problem with it, getting this information, then there was a mechanism to opt out. But that's not what happened. It became an opt-in system, which then required you to register, and it still requires you to register to become part of the community warning system, or for that matter, Nexel or Martinez Alerts, those other platforms that provide information locally in different communities. They're opt-in systems. And that's one of the drawbacks of the whole process. But to get an opt-out system, it costs a lot of money to do that. So it's an opt-in system. We think, and when we built it, it was one of the most, probably the most, the best possible system that was available in the U.S. at the time. We had a lot of people coming out, looking at our system, wanting to get as much information they could about how we were using it. In Harris County, when we went to Texas and looked at systems there, Harris County has more refineries and chemical plants than any county anywhere in the United States, probably anywhere in the world. I mean, it's an area where there's refinery after refinery, chemical plants, you name it, they're there. And what they were doing, it was a friendly county in which most of the people either had somebody that worked in a facility or knew somebody that worked in a facility. So they were industry friendly there. So all they were doing was getting information to the news media, and the news media would then publish that information. No sirens at the time. So they were using just a system of the plants notifying the news media on what was happening and getting that information out that way. So when we built our system, we knew that we were building it here in Contra Costa with a different system or different feeling on industry. This was not particularly an industry county in which people were supporting industry 100%. So, and rightfully so, because there was a number of incidents that had occurred over those years that had people, quite frankly, scared and not knowing what was going on. So, as I said, our attempt was to provide accurate information and accurate information quickly. So, if you look at the bottom, the last piece there, the system interfaces, all that we could at that time when we built it. Now, you got to remember, this is from 1994 to 2000, using the technology that was available at that time. So we worked with people from different agencies and like the National Weather Service. We were the first county to have the National Weather Service broadcast information on an emergency when one happened. So we put a transmitter up on Mount Diablo. We were able to get the National Weather Service, who had their main transformers out in Monterey County, to be able to transmit information in Contra Costa County. So we bought hundreds of National Weather Service radios and gave them to schools and daycare centers throughout the industrial corridor from Antioch all the way to Richmond, so that in an emergency, they could get some information. And then we worked on an education plan which taught people how to shelter in place, what that meant. people understood drop, cover, and hold in an earthquake, stop, drop, and roll for a fire. So we came up with stop or shelter, shut, and listen to what our themes were. Shelter, go inside, close the doors and windows, uh, wait for information, shelter, shut, and listen for information. We worked with local radio and TV stations, did a lot of advertising. We spent the $500,000 on advertising. The $500,000 came from a fine that Unical had, and we worked with the Air District at that time, and they gave us $500,000, and we used that to advertise the system. We had stuff on buses, we had stuff in BART stations. We gave out a lot of material trying to educate people on the system we were building. And then as a result of it, we were awarded a pretty significant award in Washington D.C. We received an award for the system, the National Award of the Chemical Products Stewardship for the work we were doing with the warning system. So now we have a warning system, and now it's 2000, and now the warning system is up and running. So we give the warning system to Contra Costa County. We gave the warning system to them for $1. It took us 6 months going through the legal process for CAER to actually give it to the county. When the county got it, it went to County Health Services. That's where it was originally placed. So it was under the jurisdiction of Contra Costa Health Services. Randy Sawyer, who was part of our team, was actually the guy at Contra Costa County Health Services that was responsible for the system and using it during any industrial incident. And it got a lot of use in the years that it was there, but it only stayed there for 2 or 3 years. And then finally, one day, Dr. Walker was meeting at a CAER board of directors meeting with the fire chief from Contra Costa County and the office of the sheriff, and talking about now making this an all-risk system. So at that time, the sheriff was willing to take the system, and it resides now with the office of the sheriff. And we've had 7 different CWS managers from that time until now who have used the system. So there's been an awful lot of changes in the system using the best available technology. That was a challenge. How do you keep a system like this evergreen? Because technology is changing rapidly. I mean, every month there's new technology available. So the team at the warning system, starting in 2004, started using all of the available technology that became available. And the way they fund that new technology is that Contra Costa Health Services provides them with a budget, and they use funds or they use fees that they collect from industry and provide a small part of those fees to the office of the sheriff to run the system. And the sheriff's office gets anywhere between $1 million, $1.5 million, $1.7 million to improve the system each and every year using the best available technology that's available. So we're in a process now where the funding is available. It comes from fees that Contra Costa Health Services collect, goes to the folks at CWS to continuously improve the system. So we were talking, Shahila and I were talking about, what's down the road and what improvements and how the system has evolved. Well, they're using all the platforms they can. Now, they've incorporated Zone Haven into the warning system so that they can now put out evacuation notices, information, give it to the different areas that are requesting or are asked to evacuate. And so that information gets out quickly through the warning system. And this drill that's coming up on the 30th is going to provide a lot of good information because you're going to involve the community warning system. You're going to involve evacuation plans. How active, how good are these evacuation plans? I'll tell you, as a lifelong emergency responder, uh, this goes back 50 plus years. The challenge has always been, how do you effectively evacuate people quickly and safely? And every time there's a major wildland incident, as we saw in Southern California, as we've seen in other locations, very difficult to evacuate people quickly. And that's because a lot of people don't spend a lot of time in preparedness. There is a responsibility of the people to make sure that they understand that they have some responsibility too. We can't leave it all to government, because it'll never work the way you want it to work. So an evacuation is a real challenge, and I'm interested to see how well this evacuation drill goes. The beauty of it is it's going to be held on a Saturday morning, and you're going to be practicing evacuation routes that you should already know how to get out of your community. I'm a little bit different. I live in Martinez. I have an evacuation plan, but I have so many ways out of my area that I can go a number of different ways, 7 or 8 different ways to get away from this area. I know that in the West Contra Costa County, there may be only 1 or 2 ways out. We saw the problems that happened when we had the fire in the Berkeley Hills. We see when we have a fire in these large fires any place across the country, it's very difficult to evacuate if you're not practicing and planning and knowing exactly what to do when you get that call to evacuate. So it's going to be a learning opportunity coming up on the 30th of May to see how that evacuation plan goes. It's going to be interesting to see how the warning system is used and how the information gets to you. And that's why it's important that we get everybody in the affected area. You've got a number of different areas that you're working with there in West Contra Costa County. And it's important that we get as many people in those areas signed up to get the warning system information, because that's the only way we can really evaluate if there's any gaps in the system. This kind of drill will help us look at not only evacuation and what we learned from that, but also what we learned using the warning system. So I think those things are important. Anytime, and CAER's role in that is that we participate. CAER has 7 different action teams under its umbrella. One of those teams is emergency notification. And right now, the emergency notification chair is the manager of CWS. So we get in a room and we work with all the users of the system, industry users, and anybody else that's using the system, as well as county health services, CWS, CAER representatives, and we kind of look and make sure that the policies and the procedures that are in place are consistent with the way we want to use the system to actually alert and notify people. The sirens that we use for a level 3 incident, all that is an alerting tool. You may have seen from one of the slides that we talked about the number of sirens in the system. It said 41. I think it said 41 or 43 sirens are in the system. There's actually 2 additional sirens, and this is interesting because those 2 additional sirens are located in East County, in Bethel Island, and those 2 sirens are not used to shelter in place. Those 2 sirens are used to evacuate in the event that there's a levee break in that area, because that's a hazard. So, there are challenges to look at throughout the county. We use the notification system a little bit differently for a levee break, and certainly we have areas of the county in which you have the wildland urban interface, which can be a real problem in an emergency. It's not if a fire occurs in your area. Looking at the maps, it's when it occurs, and are we ready in that part of the county to take the appropriate action to ensure the safety of all the people who live in that interface. So with that, Shahila, why don't you or somebody else ask some questions, and we'll see if we can effectively answer the questions you might have. That's a history of the system. It was quick, and believe me, it was the 15 people that were involved in this, and then the 7 after we trimmed down the thing just worked their butts off. It was the best committee I ever worked with. We had this committee formed within a couple of weeks after the General Chemical incident, and we worked together because we all had the same vision. Let's provide a system that actually provides accurate information to the people in Contra Costa County and gives them, not only alerts them, but gives them some information on what protective action they have to take, whether it be evacuation, whether it be shelter in place, whatever it is, but let's make sure it's accurate. So, Shahila, I know you had some questions, so why don't you kick it off and we can go from there.
Thank you very much, Tony. I should add that Tony himself has been a firefighter and a fire chief and is well aware of many fire-related issues. I really appreciate the history, very, very rich history. Thank you so much. And it's good that you initiated it and are providing this insight. I have a couple of quick questions. I know a portion of it is in the health department and a portion in the sheriff's department. Why was it handed to the sheriff's department? So for everyone's information, the person in charge of the entire community warning system that our lives depend on, our emergency system, as far as I know, is a relatively low-rank law enforcement officer in the sheriff's office. You would think it's a fire chief in charge. No, it's in the sheriff's office, and it's not like the sheriff himself or a deputy. I think it's a lieutenant or officer or not very high rank. But my impression of such a system or imagination is that it would be under the fire. Why was it handed to the sheriff's office?
Let me make some clarifications too, so people understand. When there's a hazardous material incident in Contra Costa County, okay, hazardous materials. I'm not talking about anything else at this point, but hazardous materials. That falls under Contra Costa Health Services. So what happens is they are the ones who tell the community warning system folks how to use the system. Now, if it happens at a facility where we have one of the computers and they're part of the system, they put quickly on a computer that goes to all the users to tell people what is going on at their facility and at what level they are calling this.
I'm sorry, by facility you mean refineries?
Pardon?
By facility you mean
refinery. Yeah.
Yes.
And it's used, and there's templates that are at each of the facilities. So all they have to do is fill out the template, press a button, that information goes out. If they call it a level 3, then sirens are sounding. If they call it a level 2, then when the county comes on the scene, Contra Costa Health Services, they take a look at the incident. They can upgrade it or they can downgrade the system. So there are safeguards built into the system. And for hazardous materials, it's used. The authority having jurisdiction is Contra Costa Health Services. The folks at the warning system do whatever Contra Costa Health Services want them to do with the system. Now, when it's used in any other fashion for a law enforcement incident, that falls under the Office of the Sheriff or law enforcement, and that seems to go seamlessly. You know, if you have somebody walk away from a facility or have some incident, the warning system, again, is used because the people that are using the system, those people are, somebody's on call 24/7 with a computer that when they get the call from dispatch on what the incident is, they can go on the computer and then use the system or any of the tools in the system to get information out quickly to the affected area. So, you know, the warning system folks in a hazardous material incident do what the Contra Costa Health Services want them to do as far as use of the system. For all other incidents, then it falls under the responsibility of either law enforcement or whoever the incident commander is at a facility or at a fire department or a police department use the system, how they'd like the system to be used.
Okay. Oh, yeah, I did not get my answer why it is the sheriff's department.
Oh,
And
why
not
did it
the
go to the
fire
sheriff's department?
Yes, not why
Yeah.
not the fire department?
Well, that's a great question, because when we were sitting at that board meeting and we had the sheriff at that time, Sheriff Rump, and we had Keith Richter, who was the county fire chief. And when we were talking with Dr. Walker on where should it go, he asked the fire chief first if the fire chief wanted it. But the fire chief at that time said they were involved, they were doing some other things, and they didn't have the time to take the warning system on. But the sheriff said he'll take it. And the deal was that they were going to get money from Contra Costa Health Services to staff those positions that were needed to use the warning system, and that it would reside under the office of the sheriff. Now there are some changes coming here in the county. County Health Services, the hazmat group, as of the end of June, the beginning of July, are going to be working under the Contra Costa Fire. So they're moving that group of health services employees that make the call on hazardous material incidents. That whole division is going under the office of the fire chief, the county fire chief. As far as I know, currently the CWS resides in the sheriff's department, and I haven't heard anything to indicate that may be moving anywhere. But anything can happen at any time.
Yeah, we hope that's one of the outcomes of this assessment. Rocky, go ahead.
Yeah, Tony, good evening. This is Rocky Saunders calling.
Yeah.
Basically, Tony, I had a couple of questions, but my first question is from a practical standpoint. The alarms, I live at Brickyard Landing, and we have one of the sirens just 100 yards away from us, and it's noticeable. So anyway, so it's very easy to understand the drop cover, the shelter in place signal, but can you use it with short bursts, for instance? Why is it not used to indicate an all clear?
Yeah, that's a great question, Rocky. When and you talked about the system in your area where you live. The only reason and you live in the Richmond area, right? Somewhere
Correct.
in Richmond.
Yeah, Point Richmond. Right.
Yeah, Point Richmond. What happened was Donna Powers, who was the council person on the Richmond council, at that time there were only supposed to be 4 sirens in Richmond. Okay. But Donna Powers met with the refinery manager at Chevron and talked about putting additional sirens in the transportation corridor, where you had tank trucks and you had rail cars going from there to Oakland or to the Richmond port. So Chevron paid an extra $400,000 and put up 15 additional sirens in the city of Richmond. We blow the sirens. The way the siren system is supposed to work, Rocky, is when there's a level 3 incident, the siren's supposed to go off and sound for 3 minutes. And then every half hour after, continue to sound until the incident is under control or mitigated. The reason we don't use the siren for all clear, the decision was made by the folks who put the policy together, and those were fire chiefs, sheriffs, people, community members, agency members, felt that the best way to get the all clear was using the media to get that all clear out. Now the warning system can get that all clear out with the phones, using either WIA, one of the tools they have, or getting that information out on their website, or texting that information if you're a user of the warning system. So it was determined by a group of, at that time, subject matter experts that thought it would be better not to confuse people, but to make sure that they knew when that siren was sounded, we wanted people to take a shelter-in-place protective action.
Yeah, that message is definitely sunk through, and everybody understands that message very much.
But I'll take that. One of the things, we have a meeting coming up on the 30th with the Emergency Notification Committee, and certainly, one of the things we look for is input, feedback on the system, what questions people might have, what concerns they may have, and we can certainly bring that up at meetings. So we're open to listening to any feedback we get from the community. You had some other questions.
Yeah, I had one other question, Tony. It's along those lines, so that's perfect. Since this is an all hazard, at least the intent is to be used in all hazards. What is your vision, or what is the vision of the current administration for using the system in earthquakes? How to alert people? Has that come up in conversation?
Right, because one of the problems, it's a web-based system now. There's so many backups in the system so that you can get information out even in an earthquake. And the perception was, get as much information out quickly to provide people with information. Well, if we have a big shaker here, everybody's going to know, hey, we got a problem, and what we better have is enough supplies to last 3 to 5 to 7 days before we can expect help. That's one of the reasons that the teams were built throughout the county to assist neighbors. We have teams that go out, and community members that work together to try and help their neighbors. But the information will go out, whatever information we can get out regarding the incident. But we don't use sirens. You don't need sirens in an earthquake situation. What you need is, hey, what's going on? What areas are affected? And that's where some of the platforms that cities have come in handy. Nexel in Richmond, Martinez Alerts in Martinez, to try and get information out. But if you have the big shaker, Rocky, I'm not sure some of those systems would survive.
Actually, Tony, you talked about new technology. Well, yeah. I do know about that technology, earthquake warning technology. I would like to talk to you about that offline, because it is very sophisticated, where you can actually give a warning before the earthquake shaking arrives.
Yeah, we got that. I had a good friend who helped build the warning system, who was the guy behind the warning system, who then worked in Mexico City, working with the folks there to get information prior to the earthquake actually hitting. So, Rocky, let me give you my phone number. I'd love to hear your input. You can get me at 925-980-4883.
Tony, you understand it's going to be recorded and then shared with the public, but I assume it's okay. I should have worked.
Thank you. Thank you, Tony. I will call you tomorrow.
Thank you.
Daniel Charles, go ahead.
Yeah, thanks, Tony, and thanks, Sohaila. The question I have, though, is I've heard the details about how effective it is to get the message out and the different avenues for that. But more for me, I mean, coming from an engineering standpoint, I'm more concerned about the measures of success. What are the benchmarks to say, okay, yes, the messages got out, but in the case of either be it a test or the drill, or God forbid, in the case of an actual event happening, what is that measure of success that says, okay, this is by this metric that we say that the system was this effective, and this is what actually determines that it was successful. Both, I think, as part of the original implementation, but then also with the yearly updates that you're also been mentioning in terms of adopting new technology to improve it on a year-by-year basis.
Yeah, that's a great question. How do you measure the success of any system, and particularly a warning system like we have here in the county? What we've been doing, CAER and the warning system folks and county health services, every time there's an incident and the system is used, there's an after action report where we get together and we talk about, how successful the system was. Were there any gaps? Were there any, what was the general feedback? So we try and get feedback from the area that was affected. We have a fire at a refinery. We have a level 3 incident. We want to go out and try and understand if enough people were that were signed up got the information. With the new tool of WIA, even people who are not signed up in a real emergency where you want to get information out to the community, you can use this federal piece of the system, which works off cell phones or cell towers to get information to anybody who has a cell phone in the affected area. But very difficult to measure the success of the incident, because it's tough to, right now in the county. I think when I last checked with the folks at the warning system, they say there's about 60% of the county residents who are signed up for the system. Okay, so I think that the population is a little over 1 million, I think, in Contra Costa County. Johila would know that better than I. It's somewhere around 1 million, 1,000,001 or 2. And so 60%, we still have 40% who are not signed up for the system. So it's difficult to, we meet whenever there's an incident to talk about, how the system was used, what we can learn from that incident, and then look at the policy we currently have. And if there's any opportunities or any changes that need to be made, we make recommendations. And if those recommendations are accepted, then the policy goes up to the Board of Supervisors because it's a county policy. And if they agree, then the policy is changed to reflect that feedback.
Thank you very much. Thanks, Daniel Charles, for the question. I just wanted to add briefly before getting Kathy's question that this evacuation drill is an excellent opportunity to evaluate community warning system. And also, one of the major concerns about community warning system is that they don't open up. We don't know how it operates. They never answer our questions. That's very concerning to us. And plus other issues I'll share with you at the end if there is time. Go ahead, Kathy, please.
Somebody else have a question?
Yeah, I see Kathy's hand up. You may want to unmute Kathy and ask your question. Unless you raise your
Can you hear? Sorry, can you hear me now?
now?
Yes.
Yes.
Oh, hi. Tony, the question about the earthquake intrigued me. What if an earthquake were to trigger an episode at one of our refineries, causing a major fire or some other kind of catastrophic a release of some sort? Would the warning system be used in that instance, concurrent with an earthquake?
Yeah, what the system can be used. You have the people that operate the system. Okay, earthquake. Just so you know, earthquake. How would it affect the refineries and chemical plants? There's earthquake standards that they have to meet, and the equipment in the refinery is built to withstand earthquakes in the 7.5 area, I believe. That's but they're designed to withstand a fairly large earthquake. But if you have an earthquake and there's a problem, and there's certainly, when we had the Loma Prieta earthquake, I was the fire chief at the Richmond refinery at the time. We had some walkways between reactors that actually came loose and fell. We didn't have any serious problems in the refinery, but in Richmond, in one of the terminals, they had tanks leaking because of the earthquake. And we responded out there and stayed with Richmond Fire and put foam on the area until we could control that situation. So, there are going to be, if we have a major earthquake in this area, there's going to be a number of different problems that'll pop up in not only in refineries, terminals, other areas, as well as the devastation that can come from a major earthquake to the residents of the community, their homes. So we have to be prepared for that. One of the good news is that most of the facilities in Contra Costa County, the refineries and the renewable facilities have their own fire department and their own fire brigade, and well-trained, bigger equipment than you find in the city of Richmond or any of the other cities. The fire equipment that they use is bigger, can flow more water, can can do a lot more, because in a refinery you need a lot more firepower than normally you get from municipal departments. So that's the good news. The bad news is if it's a big enough earthquake, there's going to be some major incidents that occur in a number of different industries. I don't know if that answered your question. Was the question, as they're designed, the facilities are designed to and built to withstand an earthquake of some magnitude. That's the standard. It's a California standard, and it's a good standard.
Tony, can I add my concern to that? I'm very concerned about all the pipelines under the city. There are hazmat, PG&E gas, and huge pipelines.
Well, if you look at a pipeline, you'll see every once in a while, every several hundred feet, where there's a big U in the pipeline. That's designed for earthquakes, to be able to withstand earthquakes.
But
So
how old
pipelines are built to above ground pipelines are built to a standard too, to withstand an earthquake of some magnitude.
aren't those pipelines as old as the refinery? How old are the pipelines?
How old?
Yes. Our
Well, they're
refinery is older than the city, is over 100 years old.
Yeah, well, don't forget what happens is every time, most of these refineries, like Chevron refineries, some of the ones were built over 100 years ago, but there's been constant updating of equipment, and there's always something going on to upgrade the facilities. So you don't find a lot of pipelines or tanks that were there 50 years ago. There's an awful lot of changes that have been made, and to try and keep up with making sure that if there was a problem, it was less likely to have a failure.
Thank you. And we're almost, we only have a few minutes left. So I just wanted to share a few of my concerns, and I want everyone to know that one of our concerns with community warning system is that it does not work based on zone haven zones, as far as I know. They work with Blueberry system. We don't know what it is. We never learned. As I told you, they are not good with answering questions. The other thing is that they don't have a dispatch center. So you would imagine such an important system is accessible at any point, right? With someone who is available to answer, like 911. No, it's not like that. So somebody needs to call them. They would call the fire chief to verify, and then there are some 3, 4 phone calls back and forth to verify it's a real thing before they activate community warning system.
Well,
So
what we did, Jahila, when I was back in Richmond, working in Richmond, we trained the Richmond Fire Department on exactly who they needed to call to get to use of the warning system. What the protocols and the procedures were, and there's a lot of work going on with Contra Costa Fire, which absorbed an awful lot of the fire departments within Contra Costa County. So you have Richmond is a standalone fire department. You have Contra Costa Fire. You have Crockett that has their own fire department, and then you have some small other fire departments, and then you have San Ramon. So the warning system folks are constantly working with the fire department, battalion chiefs, to make sure that they have the information they need to quickly get on and request how would they like to see the system used. If there's something, not a refinery situation, but let's say a tank truck on Highway 80, and we've had those incidents before. When that battalion chief gets on scene, he makes a call to the county dispatch, puts them in communication with the on-call person if it's after hours, and then they utilize the system at the request of the battalion chief.
oh no,
There's always going to be a delay. Yeah, that's the problem, right?
The hazmat side of community warning system, which works under the health department, is awesome. I'm a member of the County Hazmat Commission. I know how it works.
Right.
Some refinery people are commissioners at the Hazmat Commission and showed me, their cell phone, the commands they can issue things, how fast things could work. I'm talking about wildfire community warning system
Oh,
under.
wildfire. Okay. Yeah, wildfire.
It's a totally different
Yeah.
story. It's not like
Yeah.
that.
Well,
Yeah.
again, it's that battalion chief. Richmond battalion chiefs should be trained to make the call to dispatch. Dispatch then puts them in contact with, if it's off hours. Okay, if it's off hours, they put them in contact with the person that's the on-call person. Now, there's no question that takes a little bit of time. Okay, and I know time is of the essence when you have a problem. You want to get accurate information out as quickly as possible. But the way the system is right now is developed is that, you know, fire has to call county dispatch, who then puts them in touch with the on-call person who has the computer, will do anything they want. I know you're asking about why isn't the fire chief, the battalion chief, able to activate the system. Is that what you're saying?
The way I learned it from, and I don't want to argue because I don't remember the exact details. I talked to deputy fire chief at Confire, and it
Uh-huh.
3, 4 back and forths, the protocol to verify and make sure to activate it. That
Yeah.
was that was a load too much to me. And then the fact that they're not collaborative with the community. The fact that it's only used for extreme emergency rather than providing information. And the most important thing, we do not have any redundancy. When I'm driving down my street, there are some blind spots that the cell phone is not working. So if I'm to receive the message by cell phone, if I live there, I wouldn't receive it.
What
Uh,
I'd like what I'd like to do, Kahil, is offline talk to you about those particular incidents, because we have a meeting coming up on tomorrow with the warning system folks. We're part of that team, and we can bring those concerns back to the group and make sure that there's a complete understanding of how it's being used. And I guess the other question is, is that the best use of the system, right? Is there other ways that the system may be activated quicker, but right now we're using the best available technology. It's a challenge. There are areas, especially with wildland fires, there's an area that we need to look at to make sure that we have all the tools, and there are other tools that may be available that we should be looking at to enhance the system. So we need to continue to have that discussion with the warning system folks, with the county, and see if we can't resolve some of those issues, because they're important issues. People want to know as soon as possible if they're in any danger and be told, uh, what protective action they should take. Now, there is responsibility to the people themselves and you guys have done a great job in what you're doing to make sure, you know, uh, trees are removed, and we're using fire resistant plants around our homes. So you guys have done a tremendous amount of work in that area. We still got some work to do with, how we deal with wildland fires from a notification standpoint. And that's a great question. And we'll take that back. I know exactly what your concerns are.
Thank you so much, Tony. I really appreciate all the great information and such a wonderful system we have in our county. Thanks to you and the other members of the group you were to initiate this. The only thing is, if the sheriff's office was just a bit open and more collaborative to improve it together, it would have been awesome. So, thank you so much. And you're such a great speaker
We'll
that
we'll talk offline too, Shahil. I want to make sure that the concerns that you have are addressed, at least where we can make sure that the information we provide you is accurate information, and it may not be satisfying, but I think the quest is, let's look at all the tools out there that might be available, and if they can enhance the warning system and make it better, that's what our goal is. That's what CAER's goal is. I think that's what County Health Services goal is. I think that's the warning system's goal. But sometimes the bureaucracy of government sometimes stands in the way of quickly making some of those moves. But we'll carry that message forward.
Thank you, and we count on your partnership when we are pushing for long-range audio devices as a backup warning system, emergency alert or warning system for our area, for earthquake, wildfire, and everything.
Yeah, we've I've looked at. I know that San Diego uses those long-range acoustical devices. Siren with the ability to also provide public address information on them. When we built the warning system, that technology was not available. In fact, we were told by subject matter experts at the time, don't try and use PA systems because the message is not distinguishable. But that's 30 years ago.
Yes.
The technology today
much better.
It's much better.
And we count on your support and partnership. Thank you so much for being a great advisor and great supporter of the West Contra Costa Fire Safe Council. And we look forward to our continued partnership. And thank you very much, everyone, for participating tonight. And
thank you, guys.
Appreciate
it.
Thanks
for the
so
time.
much.
Thanks, everybody. Thank you.